It was a pretty wild ride in an ambulance over there because they went really fast, which I was very grateful for.
Right. Exactly.
I offered to drive, but they wouldn't let me.
For this Mission Monday, we're here in the CV surgery office with cardiothoracic surgeon, Dr. Smith. How's it going?
It's going great.
Well, today we wanted to highlight one of our most high-risk cardiovascular surgeries that we perform here.
Most highly complex and high-risk procedures we do is actually repair of type A aortic dissection. And that's where the patient has a tear on the inside of their aorta between the two layers. And the first part of their major blood vessels leaving their heart before it reaches the blood vessels that go up to their brain.
If I would have tried to go somewhere further, I would not have survived. I was down to my last little bitty few minutes. The way I understand it, if the aorta had ruptured totally, it blew out, but that would have been nothing they could have done for it. It would have been too late.
A patient that went through this recently, Mr. Jack Mack, do you recall anything special about his surgery?
Yeah, I actually remember him quite well because aortic dissections aren't something that comes around every day.
Right.
So he was actually my first dissection patient I've taken care of, at this hospital. And so his surgery was unique in that he actually had developed one of the potentially deadly complications. The dissection had traveled back to his aortic valve, and we actually had to replace his aortic valve at the same time because it was leaking too severely for him to be able to tolerate being put back together and then weaned off the bypass machine.
Oh, well, as we saw today, that he is doing quite well.
Yeah, he's a model patient. We always worry about these because they're high risk, and we have to cool the patients down to protect their brain from the time where we have to stop all the blood flow in the body. But now he's doing fine, and every time he sees me, he shakes my hand. So
that's amazing. I know he mentioned about how deep the anesthesia was that he was in, that he probably doesn't really remember a couple weeks or so after his surgery.
Yeah.
Is that why? Because you're protecting the brain?
Yeah, that's pretty common after aortic dissections, is for patients to have some temporary memory trouble, or even, you could say, I sometimes tell patients, if you weren't doing calculus beforehand, you probably won't be doing it right after either.
So I lost about 30 pounds during the surgery. And surgery also changed the taste, smell, everything is different. Things that I used to like to eat, can't stand them anymore.
It's interesting sometimes what some changes in the blood flow to the brain can do, and temporary problems, and in different ways that may last the rest of the patient's life. But certainly he had a problem that was deadly if not treated, and he's here today to talk about it.
Right, because excellent teamwork over there in the OR.
Yeah.
And every minute of it was devoted to bringing me back up to the point that I could get up and come out there and be functional. And that's what I have done. So I'm very much appreciative to what Singing River got here.